Welcome back to Healthwise. With us is Dr. Carl Gonsoulin and also Happy Mardi Gras. Doc, we were talking about root canals. We had gotten to that point with the teeth. A root canal is a more extreme cavity, correct?
Right. When the decay gets deeper and deeper, one thing that you should understand is that a cavity doesn't necessarily have to hurt to be a big cavity. You can have a tooth decay very, very seriously where the tooth is actually to the point where it's infected, but it's never been hurt. Never had a toothache there. Okay, so pain is not always the early enough warning system. Okay, usually if you got a tooth hurting, there's a lot going on there. Okay, but it's not necessarily the thing that's going to tell you things are okay or not okay. But when the decay progresses further and further, where the deeper it gets into the tooth, the closer it gets to the nerve of the tooth. Now the nerve is a soft tissue inside the tooth. It comes in from the tips of the root, the blood vessels, the nerve tissues, the soft tissue that actually had formed the tooth and nourishes the tooth once it's completely formed. Once this area gets infected by the bacteria, once the bacteria reaches this area, like you get an infection on your arm or something, the arm swells. Now what's swelling going on there? Part of the swelling is the fact that the body's putting in more fluid in there so it can send the defensive cells to fight off the bacteria or to fight off the infection. Well, the tooth can't swell. So it kind of causes like a traffic jam there, and the body can't get the defense mechanism in there to fight off the decay. Yeah. And so the decay wins. And once it progresses further and further into the nerve of the tooth, it eventually goes out into the bone. You start getting infection onto the bone, then you get what's called a dental abscess. Now it's infected long before that, but when you start having the toothache or the swollen jaw or something like that, that's a dental abscess there. Okay. Now once it starts involving the nerve of the tooth, you have to get rid of that infected area. You have to clean out that area, and so all that is cleaning out the inside of that area and filling out the inside of that chamber inside the crown of the tooth, inside the root of the tooth. So now there's no bacteria that can get back in there. And so basically there's no more nerve there, there's no more space there, and then the tooth can be crowned or restored, and it can be a useful tooth for many, many, many years.
Right. Do you use the same material that you use in the filling for a cavity, or is it different?
There's different materials depending on what needs to be done. In pediatric dentistry, we can do things that are similar to root canals on baby teeth, but we'll have something that's going to dissolve away when the root dissolves away. On permanent teeth, you don't have that situation where the roots are going to dissolve away. Right. But there are many, many types of ways of doing, well, there are types of ways of doing it. I'm not an adult dentist, right. But there are many ways of doing it.
So you have to do do you see many root canals with pediatric dentistry?
We see more than we want to see. It's not an uncommon procedure, you know, and the tooth gets big enough cavity on it that something has to be done with the nerve of the tooth to stop that infection. There are many different ways of treating the nerve, okay, right. And none of it has, there are partial and complete root canals depending on what needs to be done. But those can, if they're done correctly and they're done at the opportune time, you can save the tooth and have it do the function it's supposed to do. It's much better to have a tooth that's been fixed doing its job of eating, holding the space, helping than to have no tooth there, because those baby teeth have an important role in helping the body develop, helping the mouth develop, helping the speech. You need them to eat. Oh, yeah. Need them for speech. If we wouldn't need them, we wouldn't have them in the first place.
That's correct. Well, Doc, I know you're a pediatric dentist, and so is your sister, I think, yes, also. But we found out that, and we're going to talk a little bit about that in the next segment also, but I had a little emergency and I had to go to you, and I had a crown that had kept coming off, and you managed to fix it, and you fixed it pretty good. It's still there right now. So, I mean, to say that you also have a new dentist in your office, correct?
Right. We have an orthodontist in our office, and we also have an adult dentist in our office. And we're trying to make it possible for the patients to get as much service as they can get, as convenient as possible, And it's all we're talking about dental health. The only reason we fix baby teeth in the first place is to help the child stay healthy, to help the child grow, to help the child end up with a good set of permanent teeth. Okay? There are many, many reasons why permanent teeth are important, why teeth are important for us. Okay? All right? And of course, if your teeth are constantly a problem, it's easy to come up with no teeth, no problem solution. Well, doesn't work that well, because even though false teeth are amazing what they can do, they're never as good as there's no wooden leg that's as good as the real leg, you know? Right. And so there's no false teeth that are as good as the real teeth, okay, if the teeth would be in good condition, okay? And so the overall thing we want to do is, our teeth are important for us for our looks, our speech, you look in the mirror and you look what you see, you get up in the morning, you got to get out there and fight that world. It's not easy. Right. You look in the mirror and you look and you got a good looking smile, you're a little bit more happy to do that. Okay, all right. Confident. You know, and you look at your teeth and they're a source of problems, because every time you turn around there's something wrong with them. It's a source of expense. You know, it's difficult. You know, and most of those things can be prevented. We can't prevent everything. Right. But the vast majority of the problems that people end up with occurred from something that took a long time to get there and could have been prevented or lessened very easily. In other words, if you get the filling done, if you clean the teeth and prevent the cavity before it needed to be fixed, you never have to fix it. If you get that filling done before it got to the point we needed a crown, you don't have to crown it. And same thing with the root canal, same thing with the bridge or the false teeth or the implants that they have nowadays to replace lost teeth and something like that. If you get those things done before, you don't have to do those things, nor do you have to go and get involved with the expenses involved in that and the maintenance involved in that. It's a little harder to take care of, you know, a repaired tooth than it is to take care of a natural, normal, healthy tooth, you know. And so prevention is the best route. And there are lots of implications about the overall health of the body because of the health of the teeth. Okay, hold that thought. When we come back from this brief message with our sponsors, we'll come back and we'll talk about that.